Hi, Tim Ria here, Digital Health Live, CES 2015. We're in the WebMD studio, actually in the conference center, and the event has grown so big. We have 800 people here today, and we're pushed back here in this nice little studio to capture hot interviews as they come off stage. We have Dr. Ray Dorsey, MBA, and where'd you fly in from?
I flew in from Rochester, New York yesterday.
Okay. So have you been to CES before?
This is my second time. First time at the Digital Health Summit, though.
Okay, great. So you were just on stage. What was the topic of the panel? And tell me about your background first.
Sure. I'm a neurologist at the University of Rochester Medical Center, where I care for individuals with Parkinson's disease. But rather than see patients in clinic, I see patients almost exclusively virtually in their homes, chiefly.
So what's really interesting here is a big topic is basically telepresence and telemedicine, and where are we at with that?
Well, right now about 40% of individuals with Parkinson's disease who have Parkinson's disease don't see a neurologist, and one of the reasons that they can is because of distance and disability. And what we're trying to use is simple web-based video conferencing, the same technology that people use to communicate with their grandchildren, so they can communicate with their physician directly from the convenience of their home.
Okay. What were some of the things being covered on stage?
Sure. Well, what we've shown in our previous studies is that this is actually feasible to do. People can actually connect to their doctor from their home. And then second, we showed that the clinical outcomes between virtual visits in the home were closely mirrored to those traditional visits in the clinic. And third, each virtual visit saved patients and their caregivers 100 miles of travel and 3 hours of time per visit.
Interesting. And so telemedicine through sensors now through mobile devices is coming to fruition?
We're not quite there yet. We're using right now just simple web-based video conferencing like HIPAA compliant Skype for the stake, but we've done a few visits over smartphones. We're not quite there yet, but we've moved from computers to laptops to tablets right now, and you can see that the next logical extension would be using smartphones.
People are loving you right now. No, just kidding. You can hear the audience. They just wrapped up with the session if you hear the background noise. So you're working on some new things, some new trials?
Yeah, so what we're doing right now is the first national randomized controlled trial of telemedicine for Parkinson's disease. So anyone, anywhere throughout the country or large portions of the country will be randomized to either receive the usual care in their community or the usual care in the community enhanced by virtual visits from a specialist in their state. And so if they're in California, they can get the care they're getting locally in Riverside, California, or that care locally in Riverside, California, plus virtual visits from a specialist at UC San Francisco, all from the convenience of their home.
I've been playing with the new Samsung Gear VR. Actually, we have it up here. I'm curious to see. I mean, this is brand new. Nobody has this really yet. It's just coming out. But you can basically put a Note 4 cell phone right there, and that's virtual reality stuff. So this is coming out, but this will be a few years off.
We're not out there yet, but we're always looking for what's on the horizon.
So it solves a huge problem because tell me about the talent pool of doctors. As it sounds like the population's aging and we need more care, and the doctor talent pool's shrinking. Sure.
So there's about 500 Parkinson's disease specialists in the country, and there's at least 500,000 individuals with Parkinson's disease. The problem is that they're not matched. Parkinson's disease specialists tend to be located in urban environments, and individuals with Parkinson's disease tend to be located some in an urban environment, but many in rural environments where they can't access the care that they would likely need and could benefit from.
So what's the final outcome you're trying to achieve here?
We're trying to bring, in the words of Senator Tom Daschle, a death to distance and enable anyone, anywhere with Parkinson's disease or any chronic condition to be able to access the care that they need.
How do people get a hold of you?
They can learn more about our research studies at connect.parkinson.org, or they can simply send us an email, ray.dorsey@chet.rochester.edu.
Awesome. Well, I'm going to have to look that up. We'll catch up after the event, but thanks again for your time.
Thank you very much, Tim, and thanks very much to Jill Gilbert and the organizers of the CES and for WebMD for hosting the session.
Nice work. Thank you.
Thank you.